conditions, and normally for case 1 and 2, 2-3 times is enough. For more severe case, maybe we need to stay together for a couple of years. So depend very much from the case. What is important to know is, first, is not a miracle surgery. Second, a miracle surgery, no miracles. I don't know how to make miracles, okay? Second, is an effective surgery that improve the corneal thickness, reduce the curvature rays, and normally give a sufficient satisfactory central optical zone. For the rest, we have to see case by case, because some cases obviously can be more difficult, some difficult cases become more easy, but you see this is the normal variancy of the phenomenon in a life.
I was wondering if, as you mentioned before, your parasite is not bacteria and they are not viruses. So what are they? Virus, eukaryotes,
Parasite.
Yeah, what is an eukaryote?
What is a parasite?
I know what a parasite is. So, but is it a worm, for example?
Is a worm? No,
worms are parasites.
no worm.
Yeah?
No worm.
What else? I can't imagine what it is. You said it's bacteria, virus, you said it's a worm.
Listen, I spent 5 years to understand who was. I think you must wait a couple of years to know who is.
I know, but just trying to...
Is somebody that can enter in the structure and start to modify the collagen. I can tell you one thing, produce malonic acid, chondrosulfuric acid, increase the level of acido chondroitin sulfurico, okay? So as a modification of the place that help to increase the gel in the dispersed solution. So is much more solution of chondroitin sulfuric acid and malonic for the fibers. So you understand, also the gel structure of the cornea is altered from this parasite. And you know something also interesting? It seems that this parasite is capable to change the genome locally.
So how
Have you understand now? Is capable to change the genome locally.
okay.
You understand where I want to go?
Yeah.
So possibly the 4 genes come out from a modification of the parasite on the structure.
Okay, so how do I get infected then?
How you?
How do I get infected?
Now that's the second very important question. How do I get infected? Oh, finally. Now the infection comes because you must think to Hahnemann, 1750, the discoverer, German discoverer of the homeopathy. He made a consideration, thinking to the plague or other infection of the time that were very severe infection. He made one consideration. Not everybody is affected. It seems a stupid consideration. It's not. It means you can have the most disastrous kind of virus or whatsoever. Not everybody will be affected. And so you are not to be interested scientifically in the affected one. This Fyodor teacher to me, look to the other one. Why the other are not affected? The solution is not in the affected one. The solution is the one that are not affected. Maybe they have a special resistance. Or maybe, in this case, they can live in a different environmental situation. And this is what belongs to the keratoconus. To get a keratoconus, you must stay in a special environmental condition. And now we go to very antipathic matters. Geopathy is the main reason for the keratoconus, because it's a problem of frequencies. the frequencies of the gamma radiations coming out from a stream of water in the soil 100 meters under your house generate the water against the stones, generate gamma radiations, alpha, beta and gamma. Alpha and beta are very fast reabsorbed by the ground. The gamma, nobody stops them. They will reach you 1 kilometer up. So you are exposed to gamma radiation to a certain amount. Depending from your genetic, strong, less strong, energetic, less energetic, age, time of exposure, because you know that the radiation creates damages when it's low by time, is a summing exposure to the radiation. So you need time to acquire that quantity of radiation that create immunodepression and allows the parasite to enter. Is clear? Not yet? I can repeat it. Allora. Gamma radiation is clear. Exposure to gamma radiation. Time exposure. 1 month, 1 year, 10 years. Your genetic starting conditions. Strong man with an incredible immune system, weak man with a weak immune system. So these factors, quantity, time, your genetic individuality, make the difference for the sickness. The parasite will arrive when your exposure is enough to depress your immune system.
In the very beginning you said that the characteristic of Dr. Schumacher is not that successful. Can you explain?
No. I said that the operation of Professor Mike is the first new solution after my one in the field. But I am not personally convinced that will stop the keratoconus for always. I am convinced that will delay the keratoconus, but I am not convinced it will stop for the simple reason because the pathogenous agent will work. But you will have all these differences. Stronger person, less active keratoconus, less damaging environmental system, longer period of survival. You understand the parameters, how parameters can change. Vuole sapere se è un virus, come ho detto, è un parassita.
Okay. Ich sage das auf Deutsch. Ich muss Ihnen leider sagen, dass Sie Ihr Wissen in Genetik nicht richtig ist. Nicht richtig. Ja, weil, also, erstens, die Studien, die Sie erwähnt haben, die Ergebnisse sind mehr als 3 Studien. Es gibt, glaube ich, meistens 10, 11 oder vielleicht sogar 12 in der Zwischenzeit. Es sind einige mehr. Es sind noch mehrere Gene erwähnt worden, über diese 4 hinaus. Und die sind auch untersucht worden.
Sono più di 4 geni di quelli che dovrebbero essere rigenerati.
Ah, sono anche di più? Meglio.
Und jetzt zu sagen,
Bello.
dass es den ganzen Körper betreffen müsste, wenn es nur im Auge exponiert ist einfach falsch. Es gibt einen Haufen augenspezifische Gene, die nur im Auge exponiert sind. Und deshalb zu sagen, das betrifft nicht also den ganzen Körper, also nicht den ganzen Körper, kann es noch gehen, das ist falsch. Und es ist auch so, dass es verschiedene Gene sind, die für eine Krankheit verantwortlich sind. Es gibt viele Krankheiten, das ist nur ein Gen, eine Krankheit. Aber meistens ist es so, dass einige Gene zusammenspielen müssen, damit es eine Krankheit wird. Und es würde auch einen komplizierten Erbgang des Keratokonus erklären. Und nur weil es kein definiert wird, ist auch kein Grund dafür, dass es keine lineare Vererbung gibt. Das ist kein Hinweis dafür. Es gibt Familien, wo es nur eins ist.
He's talking about these studies. He is of the opinion there are more than just these studies mentioned for the genetic costs, and it is not.
He doesn't agree.
No, he's thinking that the genetic, that if there are 4 different genes, it doesn't explain confusion. It can be that 4 different genes are responsible